Greetings, students. Getting ready to start our next section. So bear with me until I pull the slideshow up and we will get started. So greetings once again. And today we're going to spend some time in chapter 9 talking about assessment, interpersonal, intrapersonal, interpersonal, and environmental factors. So these are different modes of assessment that we need to really take into consideration. And it's pretty important that you all understand what those particular dynamics are as you move on in your journey to become a social worker. So first of all, let's talk about assessing intrapersonal functioning. And so oftentimes, we hear the word interpersonal and intrapersonal. And so I want to just kind of clear up any confusion that might exist as it relates to what those particular two things mean. So when we talk about intrapersonal, it actually means within a person. So within oneself, within one mind. So it's basically really looking at how things are happening and assessing things at that level for you based on what's happening for you. When we talk about interpersonal, which we'll talk about a little bit later, it really relates to looking at assessing the occurrences or behaviors that happen between people. So one is internal, intrapersonal, one is external, which involves other human beings. So we're going to spend some time looking at the different facets of different factors that we need to take a look at assessing when we are doing interpersonal functioning. That's biophysical functioning, assessing of alcohol, mood-altering substances, cognitive, emotional, behavioral, motivation, as well as environmental systems. So biofunctioning, as you may remember from human behavior, social environment, is one of the domains that we look at in terms of assessing how well people are functioning. So this pretty much and primarily speaks to physical characteristics and presentation as well as physical health. So it's how are people doing? Because believe it or not, biophysical functioning actually can exacerbate other areas of interpersonal functioning as well. So, if I have a medical condition that could actually, that's pretty debilitating and chronic, then that could also lead to some issues around mental health functioning, around maybe being depressed. So they're tied together. So it's really important that we understand as we are working with our families and individuals to understand the physical characteristics in the presentation as well as the importance of physical health. And then their access from an environmental standpoint to healthcare and affordability as well. So those are all important factors to keep in mind. Another area that you will need to pay some attention to might be that of the abuse of medications, alcohols, and or drugs. So really looking at alcohol abuse, we know that this is a social disease, and we know that it manifests itself in a number of different ways and has an ability to severely impair individual functioning as well as family functioning. So looking at drugs, alcohol, and other drugs, understanding dual diagnosis, which could be a combination of a mental health disorder that someone might be having while they're continuing to use drugs or being addicted to drugs. So you'll need to use some definite interviewing skills to really assess what a substance use is like. And later on in the presentation, there is an example of some questions that one could use to actually format and move forward with looking at chemical health assessment. Matter of fact, they're right here. So these are some questions that you might want to consider if you've got a client and they have been presenting with whatever the issues may be. We want to really kind of get a sense of what's the substance abuse usage like. And so these may be some questions that you would think about asking a person to really kind of ascertain the level of severity that's associated with this potential abuse. So as you can see, it's about the frequency of drinking, under what circumstances, what happens, why do you do it? Does it create difficulties with partners, things of that particular nature? So these are things that you would want to really go into detail. The other pieces are around really also looking at some indications around abuse. So how do we know what that abuse might look like? There are some typical indications in terms of, so if you've got people who you're working with, they're in your office and you start to see, these types of typical indications that are located here to your right, you can actually start to think about and narrow down whether people might actually be under the influence, and the types of drugs that are here to your left that really kind of simulate, or should I say, facilitate these types of behaviors or indications that you might see. So from the nervousness, the irritability, to nodding off, dilated pupils, people, staying up for days and days on end, hallucinating, paranoid delusions, people are following them when they're really not. Those are all some things that we need to take a look at, because a lot of these particular drugs that are located here, cocaine, amphetamines, quaaludes, alcohol, they act on the central nervous system. So the alcohol acts as a depressant, while the amphetamines, meth, may act as a stimulant, along with cocaine. So again, to be aware of these particular processes as well. And you have your opioids and your cannabinoids. The euphoric pieces, it's interesting given that, a good percentage of the states in our country are really leaning more towards the okayness, I guess, of utilizing marijuana for recreational purposes. We know that it does have some benefits for medical purposes as well, but it'll be interesting to see over the coming years what the research says about how this is impacting mental health functioning and intrapersonal functioning as it becomes a legal substance. So something that's just to kind of keep in mind, as well as the opioids, sniffles, morphine, opium, heroin, which has come back and quite frankly on the rise. So again, these are chemicals that we need to really assess for and to really understand. The hallucinogens, the mushrooms, the mescaline, the inhalants, seeing a rise in terms of inhalants where kids are huffing chemicals from spray paint cans, things of that particular nature, laughing gas, anabolic steroids, which we are seeing people actually use to build up body mass, that it has significant consequences for how the body functions later on in life. So the drug piece, the alcohol piece are really important things that we need to really take into consideration. And so making sure that there's a thorough assessment done, or referring on to agencies that are able to do a more thorough assessment. In Minnesota, I think the statute is Rule 25. So a Rule 25 assessment is really a chemical health assessment that really looks at a lot of the things that we just talked about. And based on the findings of that particular diagnostic assessment, will determine the level of treatment that people might need to be involved in. So again, just to keep those pieces in mind. We also need to pay attention to assessing cognitive and perceptual functioning. So now when we're talking about cognition, we're talking about the mind in and of itself. So it's about intellectual functioning. It's about judgment, reality testing, coherence, cognitive flexibility, misconceptions, cognitive or thought disorders. So, we need to be able to assess people to understand, how are they operating from a cognitive standpoint? Do I know what year it is? Do I know who the president is? Things that people would typically normally know. If I've run upon a situation where I'm assessing someone and they are not aware of those things, that's a sign for me that there may be some issues as it relates to cognitive and perceptual functioning. Affect and assessing affective functioning. And so when we're thinking about affect, just keep in mind that affect means mood. It's another word for that particular piece. So it's about looking at affective functioning. So emotional control. Are people able to reasonably handle themselves in emotional types of situations? Are the ranges of emotions appropriate? We do have affective disorders that we know about as well. Two of the major ones that we see quite a bit from a mental health standpoint are bipolar disorder, as well as major depressive disorder. And so bipolar can be fairly complicated in that it usually involves some significant mood swings in terms of people being up and energetic for days at a time, and then crashing to these incredible lows and being very irritable and highly depressed. So again, these are disorders that we need to be aware of as well. Also, when we're looking at the effective functioning piece, we also need to recognize that in some of these instances, there might be an increased risk for suicidal behavior. So paying attention to the depression, especially within children and adolescents and older adults, is going to be very, very critical. And as you already know from some previous lessons in terms of our responsibilities as social workers, that at any point in time that we are working with a client and there is reason to suspect that they are suicidal or about to become self-injurious, then we have a special responsibility to really investigate that particular situation more so and bring in the appropriate help if we need to. So again, it's a pausing point for all of us, just something just to remind you to keep in mind. And then behavioral functioning. So really looking at problems related to things that are in excess. For example, as I have done, for example, you all know that I work on a crisis line. And so on some weekends when I'm on, I'll get a call from a particular client who I've actually come to know quite well because they call so frequently. And what's happening with this particular client is there is a OCD or obsessive compulsive disorder, and she feels the need to continually wash her hands. So when she calls and she's got concerns and she is cycling, she's really asking about, getting permission to actually continue to wash her hands or what kind of soaps that she needs to use, the whole 9 yards. So we have a clear excess behavioral pieces that will interrupt her daily functioning. Because if you're washing your hands 30, 40, 50, 60 times a day, then it's not going to leave a lot of time to actually do other meaningful pieces of work. And so when we look at behavioral functioning, that would be outside of the norms, quote unquote. And we would need to look at what types of interventions could help get that to a much more reasonable degree of functioning, as well as problems related to deficiencies. So interventions that are aimed at, acquiring skills to address behavior. So, if we got people who have significant anger issues and tend to maybe overreact to fairly routine things that happen in our lives that go wrong, and they happen for all of us, but their response might be to go to an extreme in terms of that. So really looking at what are some ways that we could help them deal with those kind of emotional difficult places that they're in to lower the number of behaviors that they actually have. And so we might need some skill building around how do we manage anger. So behavioral functioning is very important in terms of what we need to look at. Some of the patterns we'll be paying attention to: power and control, nurture, and support, and responsibility. So as you look at the dysfunctional patterns of behavior, if you start to see these things as you're doing your assessment with your individuals and families, then we know that these might be areas that we'll need to keep in mind in terms of looking at how we may craft an intervention that really addresses some of that behavioral functioning. And then we're looking to move them from the dysfunctional patterns to the more functional patterns in terms of moving towards progress. Same thing with social skills, coping patterns, personal habits, and traits. Again, looking at the dysfunctional behavior patterns, and you'll start to see these as you're kind of going to your interview or developing your relationship with your client. These behaviors start to become apparent, and it's your job to really kind of make note of those in terms of that intrapersonal functioning, because that could help in terms of help with a diagnosis so that we can look at a treatment methodology that's going to be appropriate for that particular client as well. So keeping those things in mind. Communication, accomplishments, independence, affectionate or sexual functioning issues. So really looking at the whole range of things are going to be really important pieces. Assessing risk for aggression, really understanding that, what are people's personal histories? What kind of things have they done in the past? Have they been involved in violent behavior prior to this? Do they have criminal records that are connected to violence behavior? Interpersonal relationships and social support. So who's there for that particular person? What do they normally do when things are getting out of control for them? Are there factors that we can build on? What are the psychological factors? What are the physical conditions? What are current threats and plans of violence? Am I planning to hurt someone? And what's the current crisis in the current situation? So really understanding the risk for aggression is really going to be important for that particular client and their functioning, and also can play a role in terms of the safety, personal safety for you as a social worker in terms of how you would connect with, when, and under what circumstances would you be interfacing with clients who have a history of aggressive behavior. Also then assessing motivation, really looking at the motivational interviewing to really kind of get a sense of why people do some of the things that they do, and really understanding those stages of change. So we've got the pre-contemplation where people are thinking about, or maybe not even thinking about what needs to maybe change in their life, but after they've been presented with information and there's some findings, then they're maybe into or should I say the contemplation mode, can't talk today, which means that they're thinking about like, wow, I've got some information presented to me that I wasn't aware of. Maybe there are some things that I need to look at doing different. And then making a determination, nah, I'm comfortable with the way things are, or actually I'm really not, because I don't like the outcome that it has for me and the people around me. So I'm determined to do things differently. So now we can move into an action plan where we actually start to look at addressing these different areas in the interpersonal functioning, to bring the functioning to a place of at least acceptable behavior, and then to also put in a maintenance plan to make sure that we don't drift back into that particular place that we left from in the first place. And then assessing the environmental needs. It's about basic needs. Do people have a place to live? Do they have food to eat? Do they have access to health care? You know, those are basic pieces. Is there a physical environment? You know, what's happening? What neighborhoods am I living in? What kind of things are happening in my neighborhood? Is it safe outside for me and my kids to play? Any number of things. What are the social support systems you have? Who are you connected with? Did you just move to Minnesota and you've been here for 3 months and you know literally no one? Because that's a lack of a support system, which could be problematic. And is that support system that you do have, if you are here, is that a healthy one? I mean, are there folks who are part of that social support system that are actually fairly negative, or have a negative influence, or have negative outcomes for you when you interface with that information, as well as the importance of spirituality and an affiliation with the faith community, because a lot of people do have that, and that becomes a source of strength. But we need to be able to assess, make sure that these things are present for our clients. Really understanding the ecological and social system. So, you know, this is an eco map here that really looks at and can become a valuable tool for social workers as they are intervening with people, for helping families and individuals identify who fits in all of these particular circles, where the stress is, what kind of things are working for them, what kind of things maybe not. Also doing a written assessment, you know, being able to gather all that information that you've obtained and put it into a written report, because again, you know, we got to think about why we're writing the report. It needs to be accurate, it needs to be legible, and it's a document that contains important information about an individual and an individual's life. So we do have to be very careful to make sure that we write it from an objective standpoint. And SOAP notes are a perfect example of how you might want to do some of those things as well too. The mental status exam. So this is a short exam that you can do with a client by basically taking a look and maybe asking some specific questions about different things. So how does that person appear? What do they look like? Are they dressed appropriate for the weather? Is their clothing, do they have any tics or facial expressions that are just kind of off kilter, or, you know, psychomotor functioning? You'll notice that pretty much right away. And then reality testing, judgment. You know, are people able to determine, you know, in a situation whether a certain behavior is right or whether it's wrong? Dangerous or impulsive behaviors. You know, do I really feel the need to just get in my car and zoom down 94 at 100 miles an hour at 3 a.m.? Do I have the insight? Can I maybe reasonably connect and conclude that if I involve myself in X, Y, and Z behavior, that some of the outcomes might be not in my best interest? Or is that just oblivious to me? Speech, how people are talking, volume, rate, pressured speech, nervous, anxious speech, or not speaking really at all. Emotions. How's the client feel most of the time? What's the affect? Does what they say to you in terms of the mood actually fit the effect that they actually might be displaying at this particular point in time with the appropriate amount of intensity. Thoughts, are they delusional, or are they having, um, and delusions are these undistorted, unreal beliefs. So a delusion will be, if I am paranoid schizophrenic, then when helicopters fly over my house, I think that they are projecting beams that are reading my mind. So I get very nervous and I have to wear a special helmet that I designed to help block the waves from the helicopter. That's an example of what a delusion might look like for somebody that's having a paranoid schizophrenic episode. Not really grounded in reality, but that's where they're at in terms of their level of thinking at that particular moment. So to be aware of that. And then we look at other issues around obsessions, compulsions, phobias, broadcasting thoughts, ideas of reference, homicidal ideation. I'm really thinking about doing some harm. I'm really thinking about killing this person. I'm really thinking about killing this person. Suicidal ideation. Those are thought pieces. And so really needing to pay attention to how those process works, how the client is thinking is what we really want to get at. And then sensory perception. So it's about illusions as well as hallucination. So when you think about the difference between a delusion and hallucination, hallucination involves the senses. So we've got 5 senses. So people might see, hear, taste, smell, or touch things that really aren't there. So, is that perception off or is it on point? And then the illusions, to think that people believe might be happening, but really may not be. Mental capacities, are they oriented to time, person, place, and situation? So people should know where they are, what time of day of the week it is, what time it is, who the president of the United States is, what their mom's name is, those kind of things. So general intellect, memory, concentration. And we need to also make sure that we need to be careful with our own attitude in terms of, or should I say the attitudes of the actual, towards the interviewer. So, are they hostile, are they irritable? Those kind of things are things that we need to keep in mind when we're doing a mini mental status exam. So that brings us to a close as we kind of wrap up here talking about interpersonal and intrapersonal functioning. And so I hope this helps you have a little bit better picture of some of the levels of assessment that we'll need to be doing as you're working with your clients and your families to make sure that you come up with the most accurate assessment possible so that we can move into the planning phase and then the intervention with hopes to helping things become a lot better in terms of the functionality of the individual or that family. So with that, I again encourage you to read your chapter readings and come to class prepared, and we will more than likely have an in-class exercise to really kind of illustrate your understanding of this particular concept. So I will see you in class.